Hello, and welcome to the videotape on public health. My name is Paul Nicoletti. I'm a professor in the Department of Pathobiology at the College of Veterinary Medicine at the University of Florida. What is public health? Well, health would be the opposite of disease, a disturbance in function or structure of any part, organ, or system. And so we understand what is a disease, but public health is then the health of the public. Well, what is public? Public is what we want it to be. It largely refers to populations, and that population can be small, it can be statewide, it can be national, or it could be international. Nevertheless, then health refers then to the state of disease or lack of it within a population. Now, there can be many causes that may affect public health. These can be biological, and that's what we will limit our discussion to today, but they can also be chemical, they could be physical, or they could be nutritional. Chemical would be such things as air pollution, physical would be such things as accidents, nutritional would, of course, be such things associated with food hygiene or other factors. But since we cannot cover this entire subject in the time allotted to us, we largely today will discuss the biological effects of public health, and specifically as it refers to zoonoses, which are infections of pathogenic agents, biological if you will, that are naturally transmitted between human and animals. Nearly all of these transfers are from animals to humans, but there are a few instances in which humans can also transmit diseases to animals. This transmission may take place in a variety of different ways. Most of these transmissions are by direct contact, but we may also have indirect, such as with bites, for example in the case of rabies, the inhalation of the aerosol of the agents, the ingestion, such as with food hygiene, and then with vectors, the animate invertebrates such as ticks or mosquitoes that play a role in the life cycle of many zoonotic diseases. Well, in an alphabetized order, let's consider some of the more important zoonotic diseases that occur and should be studied in veterinary medicine, beginning with anthrax. Very much in the news as this tape is being prepared, and until recently was a rare disease in humans. Few diseases cause more panic among populations than anthrax, a historic disease believed to have been one of the plagues of the Bible, and has played a role through the ages in the public's health. Well, it's caused by an organism called Bacillus anthracis that may result in a septicemia, as is shown on this slide. The bacteria are spore formers, but do not sporulate until they are exposed to oxygen. They reside in the soil in the classic forms of the epidemiology of anthrax, and the spores may persist for many decades. People who have largely been victims of anthrax in the past have been those associated with certain occupations. There are different forms of anthrax. The cutaneous form, which as the name suggests, affecting the skin and causing these lesions that are sometimes called eschars, and does not result in a systemic infection in humans. And again, there is those who work in industries such as with animal products, wool, mohair, may had pulmonary anthrax, which is the most important form from the standpoint of causation of death. Then there is finally the form called ingestion anthrax, which is from the ingestion of the organisms in contaminated meats of animals that may have died from anthrax. This form is very rare and occurs primarily in protein-deficient societies. This is the cutaneous form of anthrax, again showing the black area. These victims do recover in almost all instances, and is quite sensitive to treatments. Well, the control of anthrax in humans is primarily the control of the disease in animals. We have a very effective vaccine that is used in animals in certain areas of the United States, the so-called anthrax areas. But of course, the more frequent information about anthrax has to do with it being used as a subject of bioterrorism. Brucellosis, a disease that is found in most of the countries of the world, and in humans takes a different form primarily than it does in animals, where it is a reproductive disease and it's characteristic by abortions. In humans, while abortions can occur in affected women, it primarily is a disease of fever, of joint pains, of fatigue, and historically has been known as undulant fever, and as that suggests, the fever undulates usually by peaking during the nights and accompanied by night sweating, and then less fever during the day. It's a debilitating disease, and one largely caused by the Brucella melitensis organisms of sheep and goats, which we do not have in the United States, but is of enormous economic importance, public health in many other countries of the world. It has been an occupational disease primarily in the United States. Those who have worked with affected pigs in slaughterhouses, particularly veterinarians, farmers, others who may be around affected livestock. But around the world, a more important form or source of the disease has been the ingestion of contaminated dairy products, since the organisms are shed in the milk of affected animals, and particularly in the soft cheeses that are consumed in areas where the milk has not been pasteurized prior to its use in the formation of cheese. Occasionally there are human cases that are associated with accidental inoculation of vaccines, but this is not a common problem. There are also laboratory infections for those who may work with the cultures in laboratories. Well, the laboratory diagnosis of brucellosis is largely through the use of serologic tests, that is, those that are looking for antibody in human serums. The disease syndrome in brucellosis simulates the infections of many other causations of fever and flu-like syndrome, so that laboratory intervention, laboratory procedures are necessary to confirm the diagnosis of brucellosis. This may be a septicemic disease in humans, in which case we can culture the blood and then subculturing this off onto solid medium, as is shown in this slide, and then characterizing the isolates by various means in the laboratory. There is no vaccine that is used in humans to control brucellosis, but we have rather effective vaccines for the control of brucellosis in animals. The incidence of brucellosis in the United States is very low now because of control programs aimed toward the eradication of brucellosis from domestic livestock, specifically swine and cattle. Cat scratch disease is, as its name suggests, associated with injuries caused in humans by cats, a bite or a scratch, and caused by an organism referred to as Bartonella hensleyi. It primarily is an infection that is quite local, usually of the hand or the arm where the injury may have taken place, and an extension of this into the regional lymph nodes in the axillary area. However, in some humans, particularly those that are immunosuppressed by such conditions as AIDS, the use of certain drugs, the disease may extend into being a septicemic form, and it can, in fact, in some instances, be life-threatening because of the lowered resistance. We have no vaccines that are available for use in animals or in cats or in humans, and again, the prevention of this is largely then to handle cats with care and the washing of wounds that may have taken place as a result of cat scratches or bites. E. coli infections or Escherichia coli infections are those that are caused in humans primarily by a subspecies, the 0157H7. This has gained a considerable amount of interest in recent years because of an outbreak of this disease in humans associated with a fast food restaurant in the western United States. Since that time, there have been many studies in the area of food hygiene, not only about the disease in humans, but also the prevalence of this organism, this specific organism, in domestic animals, and particularly in cattle. While the prevalence of the disease, of the infection, because there is no disease in cattle, the prevalence of the infection is quite low in cattle, but during the processing of beef, it may become contaminated, and this is particularly true of hamburger meat, and then human infections as a result of improper cooking of this hamburger meat. There's no vaccine that is available for prevention of this in humans, and its control is primarily then associated with slaughterhouse procedures trying to prevent then the contamination of edible products from these animals. The clinical signs in humans are primarily one of hemorrhagic colitis, in other words, a diarrhea, the cramps. This may be, in fact, bloody, vomiting, a severe fever, and in particular aspect of this is particularly true in children, is one of a hemolytic uremia syndrome that, as the name would suggest, affects the performance of the kidneys and may, in some instances, result in fatalities. A very unpleasant disease in humans. While we're on the subject of food hygiene, we perhaps should also mention staphylococci foodborne illnesses. These staphylococci are primarily not of animal origin, but of human origin, because humans are frequent asymptomatic carriers of staphylococcic infections in their oropharynx, their nose, and there may be then food contamination in the preparation of foods resulting in staphylococcic poisoning of humans. And this is especially true where the food has not been properly refrigerated, such as may occur with picnics and other situations in which a number of people are eating from these same prepared foods. The control of this then is primarily through the proper care of the food and preventing the initial infection, again primarily from humans. Erysipeloid a condition in humans that is associated with erysipelathrix riciopathia. Now, in animals, this infections of erysipelathrix is known as erysipelas. But in humans, erysipelas is a streptococcus infection, and the infection by this organism in human is referred to as erysipeloid. This is primarily in humans who are associated with infected swine, but also sometimes with turkeys and fish. The organisms are present in soil and not infrequently affect swine, so that this can then again be the source of human infections. In humans, primarily this is one of a cutaneous infection that occurs with a painful swelling in the area. These do not form pus, and there is a zone of erythema, and this may also end up with painful joints and is again a chronic infection, but nevertheless one painful. Here is a slide showing the erysipelathrix infection on the skin of an affected human. There is no vaccine that is used in humans, but the control of the disease in pigs is through the use of vaccines. Leptospirosis is an infection of one or more members of the genus Leptospira, and primarily occurs in humans as a result of being in contaminated areas, particularly those that are moist, such as farm ponds, and those that may be in contact with affected cattle in milking parlors and others. The entry of the organisms into the human is through the through the mucous membranes of the eye, of the conjunctiva, perhaps of the oropharynx, and affects initially the liver in humans, where it may result in fever, malaise, anorexia, then later extending into a renal syndrome, where there can then be icterus in the humans, which is usually the situation in which the disease would be first suspected by a clinician. So we've listed on this slide some of the clinical signs in the acute syndrome in humans of fever, depression, and also in hemoglobinuria, because again this results in a renal infection, and as again icterus may be formed. Lyme disease, again named for Lyme, Connecticut, where the disease was first described, has become the most reported human infection associated with tick-borne infections, and the white-footed mouse is the principal reservoir of this, but the disease then is transmitted to humans through the bite of the Ixodes tick. In humans, the primary initial sign of this is a reaction to the tick bite, sometimes called a bullseye rash, and then extending into arthritic signs, sore joints. This is the Ixodes tick, and it is the nymphal form of the tick that is the most important in transmission to humans. These are very small, as is shown in this slide, and this then is the characteristic lesion that occurs in humans following the bite of this Ixodes tick. The laboratory diagnosis of Lyme disease is somewhat complicated because of the sensitivity and lack of specificity of some of the tests, and that then must be followed by a Western blot in order to confirm the diagnosis. This is a reportable disease in human medicine, but is not a reportable disease in veterinary medicine. So we are not sure of the number of cases that may occur among dogs, for example, cattle, horses, other susceptible animals, but we do have good reporting on human diseases and the very high prevalence of this that occurs in the northeast part of the United States as opposed to other areas where the tick is found. And in this slide we can show the coloration of the map to be in the northeast United States, where about 90% or so of the reported cases in humans come from. Another area then in the Minnesota, Wisconsin area, and then some in the northwest part of the United States, again associated with tick carriers, primarily the Ixodes scapularis in the northeast and the Ixodes pacificus in the western part of the country. Plague, a very historic disease, and has played a role in the evolution of societies throughout the various ages, caused by an infection of the bacterium Yersinia pestis, and characterized by fever and chills, headache, and this is contagious between humans, and so isolation of affected humans. There are several forms of this. The bubonic plague, which is quite well publicized over the years, largely then affecting lymph nodes, but it may extend then into the septicemic form, which, as I've suggested, is contagious and also life-threatening. In this slide, a picture which was donated to me by a friend in Czechoslovakia, showing victims that died of plague back many years ago. Plague was the cause of the Dark Ages centuries ago, and has certainly been a feared disease over the many years. Historically, plague has followed ships. The reason for this is because in cargo ships it is not infrequent to have rats aboard these ships, and the organisms being carried by affected rodents, in this case rats, then coming aboard and then spreading the disease among other rodents of the area, and then the infection of humans caused by the flea feeding on the affected rodents and resulting in the disease in humans. Again, on the slide, the clinical forms of bubonic, but it again can be also in the pulmonary form, the systemic form, if you will. This slide showing the enlarged lymph nodes in the bubonic form in this human of the axillary area. In this slide, we're showing the affected ground squirrel, the hemorrhages that occur, and also the internal lesions in the liver, and causing the death of these rodents. But in the meantime, again, the flea becoming infected and feeding on the human, as is the skin, as is shown here, and resulting then in the spread of the disease. Ornithosis, psittacosis, chlamydiosis goes by a number of different disease names, but all caused by the organism Chlamydia psittaci. Psittacosis is primarily the form of the disease that occurs in the psittacine birds, the parakeets, the parrots. Ornithosis more commonly refers to as the disease occurs in domesticated poultry, particularly in turkeys. But nevertheless, the disease syndrome in humans is similar regardless of the source, and primarily associated with mnemonic signs from the organisms that are demonstrated in this slide. Again, syndrome being one of fever, chills, and particularly one of coughing and muscle pains, again associated with the inhalation of these organisms from affected birds. The laboratory diagnosis is primarily through serologic tests looking at increases of the antibodies in suspected humans. This disease is rarely life-threatening, but may cause this pulmonary syndrome, which can be quite serious. For the control of the disease is primarily through the control of it through the control in birds, particularly again with the cytosine birds. Cytosine birds sometimes are imported into the United States and may undergo a quarantine. This is particularly because of the possible presence of Newcastle disease among these, and while they are in quarantine, the feeding of antibiotic feeds to reduce or hopefully eliminate the infection in the birds that may be carriers without showing any clinical signs. There are occasional outbreaks among turkeys in production, and this, of course, would then be the source of possible human infections. Rabies, perhaps the most feared of all of the zoonotic diseases, because it is inevitably fatal in humans whenever clinical signs occur. It goes by a whole variety of different names, has historically been known as hydrophobia because of the so-called fear of water. This is because of the paralysis of the pharyngeal muscles, the inability to swallow as a result of rabies. Around the world, the dog is the primary reservoir of rabies, not so in the United States, but around the world it is estimated by the World Health Organization that there may be as many as 40,000 or more human cases that occur as a result primarily of dog bites. Again, this is not so in the United States. This is caused by a bullet-shaped virus, a rhabdovirus, that has certain antigenic qualities for which we can develop monoclonal antibodies that are useful in determining the source of the rabies in the animal that is being examined. And in this slide is showing the presence of these respective monoclonal identified viruses in the parts of the United States, and you'll note that on the eastern part of the United States, the principal type is one of raccoons, while in the Midwest, skunk rabies is much more common. This does not suggest that all rabies in that region are occur in those respective animal species. It merely says that there are the specific antigenic types that occur in that region. And so, for example, if rabies occurs in a dog in the eastern part of the United States, it is likely to have come from a rabid raccoon and can be identified then as in that particular classic identification of the rabies virus. Again, in the United States, dog rabies, cat rabies has largely been very well controlled, but now in the United States, rabies is primarily one of wildlife. So over 90% of the reported cases of rabies in the United States occur in wildlife. Not so in the rest of the world. As I suggested before, the dog is a major factor in rabies in many areas, such as in India and Pakistan, that particular area, but occurring also in other parts of the world. You can see from this slide that the number of cases of reported rabies has continued to largely go up over the last several years, and what has largely gone down has been the numbers of cases in domestic animals, while the number of cases in wildlife has continued to go up. And in this slide, among the domestic animals, we show that the numbers of cases in cats now in the United States exceed the number of cases in dogs. There are explanations for this, and that the reduction of rabies in dogs in the United States is primarily associated with 2 or 3 factors. including the control of stray dogs, animal control, if you will, and also the compulsory vaccination in the municipalities and other regions on the part of particularly aimed toward dogs, but also in many areas also cats are required to be vaccinated at intervals that are determined by local authorities. There also, I should add that another factor has been the improvement of animal vaccines that are used in domestic animals. You can see on this slide that the number of reported cases of human rabies in the United States has gone down over many years, and again the reason for this has been largely the reduction of animal rabies among domesticated animals, dogs and cats in particular. We now have approximately an average of 1 or 2 cases of rabies each year in the United States. And interestingly, nearly all cases of rabies now in the United States are associated with bats, and particularly the silver-haired bat. A rather perplexing aspect of this is that while rabies is considered to be transmitted only by, or largely, by the bite of an infected animal, in the case of human rabies in the United States, many of these cases have no known bat exposure and yet have been identified as the bat type using monoclonal antibodies, again, for the identification of the virus. Raccoon rabies has spread northward in the United States, initiating, we believe, in Florida, and the translocation of raccoons from Florida into hunting clubs in other states in the eastern part of the United States, and then the spread of the raccoon rabies northward. And you can see from this slide that this continues to occur. And indeed, raccoon rabies has now been found in Canada for the first time, where fox rabies has been more prevalent in the past. There are programs that are aimed to try to control this raccoon rabies, also wildlife control in particularly aimed toward the coyote in Texas, and we'll come back to that when we talk about oral vaccination. In any case, as far as susceptibility to rabies, this varies among animal species, and it is those of the family Canidae that are the most susceptible to rabies, the coyotes, the foxes, and wolves, and so forth. Those of intermediate susceptibility are listed on the slide: skunks, raccoons, others, and there are some animal species, specifically the opossum and the squirrels, which seem to be highly resistant to rabies and are almost never reported, regardless of the circumstances. Well, as far as transmission is concerned, rabies historically is associated with bites. The bite of an infected animal and the virus being present in the saliva, being introduced in the wound, multiplying in the area, and migrating through the nerve canals, the nerve sheaths, toward the brain, so that the seriousness of the disease the progression of the disease is associated with the amount of viral particles that may be present in the saliva, also the area of the body that may be affected, and also by the biting species and the immune status of the animal that has been bitten. There have been a few cases that have been reported in which airborne transmission has been considered, in such things as caves, presumably from the dispersion of viral particles in the air from bats. And then there has also been the rare case that has been transmitted by corneal transplants, but that is no longer a problem since donation of corneas is forbidden from anyone who has died of an encephalitic disease that would include rabies. For the incubation period, it can be quite variable, depending again on the circumstances which I just listed, having to do with the position of the bite, etc. In general, the incubation period is considered to be approximately 2 months, but as you can see from this slide, is quite variable in the respective animal species that have been studied. Classically, rabies occurs in 2 major forms: the so-called furious rabies, or mad rabies, if you will, in which the animal becomes quite vicious, strikes at any stimulus, such as a stick or any other stimulus, anything that is in the way, and then the gum rabies, in which there is a lack of viciousness. Furious rabies is more likely to occur in cats than in dogs, and can be very serious because cats tend to, as I say, be more commonly affected by the furious form, and in this become more furious than many other species. So that some of the clinical signs of rabies in the furious form would be those that we have just described, and that is barking, the snapping at stimuli, and then in the chronic form, there would be paralysis of the laryngeal muscles, weakness in coordination, and subsequent death in both of these forms with respiratory failure. And these, the percentage of furious or chronic forms of rabies varies from animal species to animal species, but may occur in almost any animal in which rabies occurs. So clinically then, we look for behavioral changes. This is the most important aspect of rabies insofar as it's being suspected, and that is that animals do things that they normally would not do. There is a peripheral neuritis, a itching, a pain at the local area, and then a paralysis, as we've suggested, of the motor nerves, and then in some particular animals and others where, such as cattle, the altered phonation, in other words, the change in the voice, is a rather characteristic aspect of clinical rabies. Well, the diagnosis of rabies, we have no antemortem tests in domestic animals which are useful, so we must depend upon postmortem examination of brain specimens. This is primarily by the fluorescent antibody test, while mouse inoculation can also be used. Not many laboratories now perform mouse inoculation. This is of suckling mice with an intracerebral inoculation of suspected specimens. So it is a fluorescent antibody test that has become the standard postmortem test, and in this slide we show the fluorescence of the virus antigens using a specific antibody using a fluorescence microscope. How do we handle an animal that has been involved in an unprovoked human attack? In other words, the human did nothing to provoke this attack by the animal. Well, if this attack is by a wild animal, it is unnatural for a wild animal to attack a human, and so we would consider this to always be suspicious of rabies in an area in which rabies occurs, and the animal should in fact be sacrificed if it is available, and the brain examined for the rabies virus. If it is a domestic animal, the first is that this animal is detained for 10 days. The reason for the 10 days is that if the attack occurred as a result of rabies infection, then within those 10 days, that animal will continue to show clinical signs of rabies within that period. This changes, of course, if the animal has been bitten by another rabid animal, and in that case, the animal is handled differently depending upon the circumstances of vaccination. If the animal that has been bitten by a rabid animal has been previously vaccinated, as in the case, for example, of a cat or a dog, then there is a 45-day confinement period with a revaccination. If that animal did not have a valid vaccination previously, then that animal is quarantined for 6 months, or preferably destroyed and the brain examined for rabies virus. If the owner is unwilling to sacrifice the animal, then there is a 6-month quarantine period to allow then for the incubation period that we talked about earlier and a vaccination prior to release. Humans, there are excellent vaccines that are now available for humans, and for certain occupations, a prophylaxis in the form of a pre-exposure and using 3 doses of vaccine that may be administered intramuscularly or intradermally is used. And then a possible revaccination depending upon the titer that is examined some period of time after this. For a post-exposure, depends again on the vaccination status. If the human had previously received vaccination, then there is a limited post-exposure where if the animal, if the human, which is the usual case, has not been vaccinated previously, then there is a series of 5 doses of the vaccine given over a periodic spacing, and that may be accompanied, or should be accompanied, by the use of a antiserum in the form of a human globulin. We do not recommend general vaccination of the public against rabies, but do recommend vaccination of those whose occupation takes them more commonly into contact with animals that might possibly be rabid. And some of those occupations are listed on this slide: veterinarians, animal control officers, those who work in laboratories. For wildlife vaccination, there is a vaccine that has been developed, recombinant vaccine, that is directed toward oral inoculation, and this being put into a bait for consumption by the target host, and the oral vaccination, if you will, that occurs as a result of this. This is a very safe vaccine, and results in antibody formation in a high percentage of animals that receive this, and is, as I previously said, has been used in target areas and in target hosts, such as in Texas for coyote rabies, such as in other areas, Virginia and other places, directed toward raccoon rabies. And the efficacy of this having been measured by the numbers of cases of rabies reported prior to the use of the wildlife vaccination, and those that are reported after this. And in nearly every instance, there has been a dramatic decrease in the number of wildlife cases, so we believe that this has been highly effective. This actually followed a program in Europe that was directed toward fox rabies, and the use of the vaccine initially in chicken heads and then subsequently in other baits that were used. This shows the bait. The baits are manipulated according to the target species. In other words, if it's directed toward raccoons, it may contain fish meal. If it's directed toward coyotes, it may have different component than that directed toward raccoons. This slide simply shows some of the areas of the United States in which there have been these bait programs that have been used to try to control wildlife rabies. Salmonellosis, members of the genus Salmonella, and this is primarily a infection of humans that is associated with foods of animal origin. There can be human carriers, but this is not zoonotic, and occasionally associated with insects, but primarily those foods associated with animals, particularly poultry. Some of the factors that may affect salmonellosis in all animal species is the serotype of the salmonella, the numbers of bacteria that they may be exposed to, and the routes of exposure, the age of the host. Salmonellosis more commonly occurs in humans, in the young and in the old. and other stress factors that may occur both in animals and in humans. Turtles, the small turtles, have been the source of a number of human infections, particularly again among children who may play with these. These turtles have no evidence that they are infected, but may shed the salmonella in the feces. This may contaminate the water or the hands of children, who then may put their fingers in their mouth, and as a result of this come down with salmonellosis. Another animal species that has become important have been pet iguanas, which are also, like turtles, frequently infected and shed the salmonella in the feces, even though they show no clinical signs of being infected. The numbers of cases of salmonellosis has continued to go up in recent years, peaking at 1 year because of a particular episode of contaminated milk and improper processing and pasteurization, but over the years has gone up, surely because of increased detection methods, but also because of the way we process foods in this country. And for example, the primary source of salmonellosis has been, in many instances, poultry products, and here we show that chilling that for the lower temperature in the poultry processing, and if that water becomes contaminated, then the carcasses that may be coming through that chilling vat may become contaminated and subsequently result in human infections because of the care or lack of it of the way that the food is processed in the kitchen. Another zoonotic disease that we should consider is toxoplasmosis, caused by the protozoan Toxoplasma gondii. The cat is the primary host of Toxoplasma, and quite often in the cat there are no clinical signs of the infection, but again serving as the reservoir of the Toxoplasma. Here is the Toxoplasma gondii encysted in the tissues of this animal. This slide shows the life cycle, direct and indirect, of the Toxoplasma that may occur. Animals that may ingest the Toxoplasma, which are shed in high numbers in cat feces, such as swine, others may become infected, and if improperly prepared, humans may get toxoplasmosis this way. More commonly, toxoplasmosis is a result of direct or indirect association with cats. This is particularly true in pregnant women who may handle the cat litter box and may become infected this way. So historically, classically, this is the most serious form of toxoplasmosis that may result in abnormalities in the developing fetus. Children may also become infected this way. So the control of toxoplasmosis is mainly directed toward the kind of association that one has with possible infected cats. The prenatal infections in humans may result in stillbirths, in retinitis, hydrocephalus, and is a very serious disease in those humans. Prevention then would be the proper handling of the meat, cooking, and again, particularly aimed toward the litter box or the way that one associates with possible infected cats. Trichinosis, historic disease, we feel rather sure that this is the reason for the taboo among some societies about the ingestion of pork meat, caused by a small parasite called Trichinella spiralis, and in humans may result in clinical syndromes, particularly associated with muscle pain. The life cycle of this involves primarily pigs, although walrus meat has also been incriminated as a source of human infections, and the humans then ingesting the pork that has not been properly prepared, and also the cycle within pigs may be characterized by that includes rodents, but this is very uncommon. The numbers of cases of Trichinella spiralis here is the encysted larvae that are released within the gastrointestinal tract of humans. The larvae develop into mature worms. They mate, and this may result then in the clinical signs shown here among humans. Again, this is quite rare. The reason for this is because not only has there been much publicity about the preparation of pork among the consuming public, but also the way that the swine are produced in the United States. And so now trichinosis cases, when they occur primarily in small outbreaks that principally occur as a result of home slaughter, where the meat has been improperly prepared and thus ingested by humans, resulting then in trichinosis. But again, the numbers of cases of trichinosis has continued to decline. It has also been helped by provisions for that require the cooking of garbage that may be fed to swine, a fairly common practice, particularly among commercial garbage, that is garbage from commercial sources such as restaurants, hotels, and this having been as a result of other diseases such as hog cholera, such as vesicular exanthema, that the reason for then the control of this, but as a side effect of this, has been the reduction of the numbers of cases of trichinosis. Tuberculosis, while it remains a zoonotic disease, nevertheless, human tuberculosis in the United States now is principally not of the zoonotic origin. It is of other human origins, and animals playing no role in this. So historically, then, there is the M. tuberculosis, which is considered the human strain, and that rarely affects domestic animals. We have had cases in which humans have been the source of infection for dogs, and these dogs then developing tuberculosis from the human strain. M. bovis has then been the target of eradication for many decades in the United States, and as a result of compulsory pasteurization of milk, and as a result of the eradication program directed toward bovine tuberculosis, the numbers of zoonotic cases is now very, very small. Then there are some other mycobacteria which may be of importance in human tuberculosis, but have no real significance insofar as zoonotic disease. Tuberculosis historically is one of an aerosolized infection, one primarily of a pulmonary infection, where that from the bovine sources was more historically associated with lesions in bones and other tissues such as this. The organisms, you'll recall, are acid-fast. Here's a slide showing the contrast staining of the organisms. Primates may become quite susceptible to tuberculosis. They largely do not have a problem with the disease in natural habitats, but old world species of primates, monkeys, others, that are used in zoos or in biomedical research may become quite susceptible to the human form of tuberculosis, and often it is a human which initiates the infection, and then the disease is transmitted within those primate populations and possibly then transmitting it back to infected humans. There have been many instances in which primate colonies have been devastated by tuberculosis of human origin. This is the lung of a monkey showing extensive lesions of tuberculosis here, The diagnosis of human tuberculosis is primarily initially on the basis of a skin test and then subsequent chest x-rays, possible cultures, the history of their environment, and so forth. But again, primarily these are not of animal origin. We should quickly mention a few zoonotic diseases that are associated with parasites, particularly those from the dog, Toxoplasma caracanus, the roundworm of dogs. Humans may become infected from the larvae of these, resulting in two critical forms, the visceral larval migrans and also the ocular form of this, that may end up causing lesions in the eye and tragically have been misdiagnosed in some instances as retinoblastoma, resulting in the removal of the affected eye. Clinicians are now a bit more informed about this, and so those cases that occur, this is considered as part of the diagnosis. Then another worm of dogs, the ankylostoma, also may cause what is called a creeping eruption, and the cutaneous larval migrans, and this is a result of contamination of contacts with contaminated soil, feces, others, and resulting then in the larva penetrating the skin, as is shown in this slide, a very intense itching, not life-threatening to be sure, but in a very uncomfortable situation. There is a parasite of raccoons called Baleascariasis that may result, it's a large roundworm that may result in human infections in some parts of the country, a very serious disease of humans because it may result in encephalitic signs and frequently is fatal. There are other parasites such as the Taenia solium, Taenia saginata, where the human is the primary host of these tapeworms and have a life cycle through either pork or through beef, and then the cycle is completed when humans ingest the cysts that may be from improperly prepared foods. The inspection procedures in the abattoirs and the slaughterhouses will detect these cysts, and proper condemnation or preparation of those is done. Neither of these is a major problem in the United States, especially the Taenia solium, which is very rare in the United States. Echinococcosis, the dog, is the principal host of the Echinococcus tapeworm. They shed segments, and these may be picked up by other animals, domesticated animals, sheep, whatever, and result in cysts, such as shown in the slide here, in the lungs and in the liver. But from a zoonotic point of view, sometimes in children, others that may become contaminated may ingest the cysts, the tapeworm eggs, and this may result in cysts in some of the soft tissues, and can be an important disease. Not a common disease to be sure, and the control of this is directed toward the control in dogs. This is a slide showing a cyst of the Echinococcus. Finally, then, back to another zoonotic disease that is quite new in the United States, the West Nile virus that invaded the United States in 1999, apparently for the first time, was initially thought to be St. Louis encephalitis, but was then subsequently shown to be West Nile virus. How the virus came to the United States is still unsure, but is believed to have, based on molecular epidemiology, is believed to have originated in Israel, where the infection has been known for a long, long time. Initially, the virus affected humans, but subsequently was found in birds, especially in crows, ravens, crow being the most, apparently the most susceptible of this, and also being found in horses. And a number of cases occurred last year, but this year there's been an increase in the number of cases affecting horses with about a 30% mortality rate, and this simulates the disease that is caused by the Eastern encephalomyelitis virus. The mosquito is the primary, the Culex mosquitoes are the vectors of West Nile virus, and dead crows are a very important surveillance system for detecting the presence and dispersion of the virus within the community. There have been a number of human cases this year in various areas of the United States, but no deaths that have, at least up to now, been attributed to the West Nile virus. However, as I suggested, frequent infections in horses. There is no vaccine that is available for use in humans. Research is active in that area, but in horses, a recently distributed vaccine of unknown efficacy is being used to try to control West Nile virus in horses. Well, we've covered some of the important zoonoses. The World Health Organization lists over 200 infections of humans that may be zoonotic, so we obviously have only covered some of the more important ones as they pertain to the United States. I would encourage you to review some of the zoonotic diseases, particularly those associated with parasites, which we did not cover very adequately. I wish you good luck. It's been a pleasure to have presented this to you. Thank you.